I know. Seriously, turn around, timely.
Stop talking and travel.
Speedily, take advantage, tragically.
No. See, it's the last T that throws us.
What are you guys doing?
We're trying to figure out what STAT stands for.
Stat?
Yeah, stat. Like, you know, like, get me an IV, stat.
Suddenly, things are terrifying.
Ooh, that's a good one.
It doesn't stand for
I think that could
anything.
be it.
What?
It's Latin, statum, meaning immediately.
You speak Latin?
No, nobody speaks Latin. It's a dead language.
Morning, everyone.
Morning.
Okay, today I'd like to talk about issues relating to oxygenation. Can anyone tell me what a pulse oximeter is?
A pulse oximeter is a device that determines the amount of oxygen saturation of arterial blood.
Good. When could it be used?
Well, a physician might order a frequency or parameters for checking a patient's oxygen saturation.
Good. Any other time? Okay, well, it's also an intervention that can be used according to nursing judgment and facility policy. Now, the accuracy of the reading can be affected by alterations in circulation, movement by the patient, and substances such as nail polish or artificial nails.
Really?
Yes, depending on the particular model of the oximeter being used. The other skills that we want to focus on today relate to delivering supplemental oxygen. Oxygen can be delivered to a patient in a few ways. Each has a specific function and oxygen concentration. The device used is selected based on the patient's condition and their oxygen needs. Now, some of the patients with whom you'll be working today are using either a nasal cannula or a mask. Any questions? No? Okay, well then, Melissa, why don't I follow you to your first patient? Okay, so tell me about your patient.
Well, we're monitoring my patient's oxygen saturation to assure he's maintaining adequate oxygenation.
Does the order include parameters?
Yes, it does. We're to titrate the flow rate of his oxygen to keep his saturation at or above 92%. I think that means we're to adjust the rate, right?
Right, very good.
Right, and we're to call the physician if his oxygen saturation drops under 92%.
Okay, let's go check his oxygen level.
Okay. Hey, Mr. Howard. So I'd like to check your oxygen level, make sure you're getting the right amount. Is that okay?
If it'll help, sure.
Okay. Let me see your ID bracelet. Can you say your name?
Marvin Howard.
Great. This is my instructor, Miss Lewis, and she's going to be observing us today. Is that okay?
That's fine. The more opinions, the better, right?
Right. So I'm going to be using your index finger for this. So now I'll assess the pulse closest to the site and capillary refill.
What if the circulation is inadequate?
Then I could use his earlobe or the bridge of his nose, providing I had the right sensor for the sites.
Or you may use his toes, providing the circulation isn't compromised.
All right. So now I'm going to cleanse the area with an alcohol wipe to prepare the site. And you don't have any nail polish on, so.
Not today. But would that matter?
Yeah, it could interfere with the measurement, yes, and we want the results to be exact. And you don't happen to have artificial nails?
Jeez, no.
Okay, so now I'm going to double check the connection of the sensor probe with the pulse oximeter and, of course, the equipment.
Machines will have a bar or a waveform indicating signal strength and or an audible beep. The probe has two sensors, a light emitting sensor and a light receiving sensor, and they have to be properly aligned in order to get an accurate reading.
Okay, so now we're just going to place the probe securely onto the skin. Okay, I've got a reading, so I'll remove the sensor. And your reading is 100%, which is just fine.
Oh, that's good.
Any non-disposable sensors should be cleaned, and don't forget to document the oxygen saturation reading in the patient's record.
Thank you. Will do. All right, Mr. Howard. You're all set.
Thanks a lot.
Okay.
Miss Lewis, I checked my patient's oxygen saturation level, and she had a reading of 91%. She was short of breath, and her nurse consulted the patient's physician, and she ordered oxygen.
At what rate?
4 liters per minute. Will you come and help me set it up?
Sure. Just check the physician's order and make sure that you've got all your supplies. Okay, we're good.
Thanks.
Let's go.
Yep. Hello, Mrs. Keene.
Hello.
Hi. This is my nursing instructor, Miss Lewis, and she'll be working with me today.
Okay.
Okay, now your doctor wants to give you oxygen to help you breathe better, and it's given in something called a nasal cannula. And it's a soft plastic tube that fits into your nose. Can we put it on?
Oh, yeah, I've seen those on TV.
Yes, they are. They're really quite common. Do you mind if I take a look at your ID bracelet? Thank
Sure.
you. And can you tell me your full name?
Yeah, it's Alice Keene.
Okay, thank you.
You know, I've seen all the things in here on TV. And I know that they beep and they hum, and in some kind of crazy way, it makes me feel better.
Really?
I don't know why.
Okay. You mind if I just take a listen to your chest?
Okay.
Thank you. Okay. Okay, you can sit back down now. Okay. Now I'm just going to hook up the humidifier and connect the nasal cannula to the oxygen source and flow meter.
Great. Now adjust the flow rate to the ordered amount.
4 liters per minute.
Yeah.
And now I'll just check for adequate flow.
Okay.
Feels good. Okay, Mrs. Keene, I'm going to put this on you now, okay?
Perfect.
Now, if the prongs are curved, the curve should follow the angle of the nose with the points down as they enter the nostrils.
Okay, now I'm just going to loop the tubing around your ears. Okay. How's that?
Just fabulous. I feel like a real patient now. Oh.
Okay, now using gauze pads, I'm just going to put them under the tubing of your ears to relieve the pressure.
Okay.
Okay. Can you look towards me, Mrs. Keene? Thank you. All right. How's that feel?
Oh, a custom model.
Okay, Mrs. Keene, now just breathe through your nose with a closed mouth. Okay. Great.
Can do.
All right, wonderful. But everything else is okay? You're comfortable?
I think I feel a little bit
A little bit?
better now.
All right, good, wonderful.
Thank you.
You're welcome. Okay, I think we're finished. Now I'll just document the procedure, noting the liters of flow per minute and the patient's response to the therapy.
Great.
Okay, Mrs. Keene, we're all finished. I'll be back to recheck your oxygen level now that we have you on the oxygen.
Thank you, darling.
You're so welcome.
Thank you, Mrs. Keene.
You're welcome.
Have a good day.
Oh, someone's on the move.
I was just looking for you. Can you help me apply a partial rebreather mask?
Of course. What's the situation?
Well, my patient has had some changes in his respiratory status, and his oxygen saturation has dropped to 89%. So his nurse called the doctor ordered a mask, and with an oxygen flow rate of 10 liters per minute.
Okay, that's fine. When you're putting it on, it's important to make sure that the mask fits snugly around the patient's face. If it's loose, it will not effectively deliver the right amount of oxygen.
Right.
And be aware of meal times because
the patient can't eat with a mask on.
Exactly. So there should be an order for oxygen via nasal cannula during meals. But because the amount of oxygen with the cannula will be less than the mask, return to the mask immediately after his meal.
Okay, should we go?
Yeah, let's.
Hi, Mr. Simon. This is my nursing instructor, Miss Lewis.
Hi.
Your doctor wants us to change the way we're giving you oxygen, so I'm going to put a face mask on you, and this is going to give you more oxygen and help you breathe easier. Okay?
Listen, there's no way I can use a phone, is there?
Excuse me?
Call my office. Look, I've been here a lot longer than I expected, and I'm missing a meeting. Is there someone here who can set me up on a conference call?
Mr. Simon, think about how you feel right now. It's really important that we raise your oxygen level, and the mask will help accomplish that.
A mask? Look, you gotta be kidding me. Then I won't be able to talk at all. Look, maybe I can write some things down. They can relay it over the phone.
I suppose so.
Look, I know that you think I'm asking a bit much, but I have a lot of work that... All right. I guess if you spoke to my doctor, I will. I was in the hospital, right? It's a reasonable excuse.
It's
Yes.
a reasonable excuse. I think they will understand.
I think you're right. Thank you.
All right, okay. I'm going to check your ID band. Can you tell me your name?
Robert Simon.
Okay. I'm going to listen to your chest. Is that okay? Down for a minute. Just take some deep breaths, if you can. Okay, Mr. Simon. We're gonna get the face mask connected to the setup, okay?
Okay, remove both flaps from the mask.
All right, I'm just gonna lay this right next to you. There we go.
Once you've adjusted the flow rate to the ordered amount, be sure to let the bag fill up with oxygen prior to placing the mask on the patient.
Right, of course. All right. Okay, I'm gonna put the mask on you now, Mr. Simon, okay?
Okay.
We're just gonna take these out. Right. Lay that here. Put this on you. And it's here to protect your ears. Can you look at me? How's that feel? All right? That's it. Okay, everything looks great. So, right, I'll document, including my assessment, the type of mask used, liters per minute flow, and the patient's reaction to the procedure.
Great. Now, skin integrity can be compromised due to moisture and pressure under the mask. So regular assessment of the area under the mask is an important part of care.
Right, so I'll remove the face mask and dry the skin every 2 to 3 hours and check for any skin irritation.
Good. And powder should never be used around the mask.
Got it. Won't touch the powder. I'm going to stay with Mr. Simon, make sure he feels better, and recheck his oxygen level. Okay, Mr. Simon?
Okay. I'll be back to check on you both.
So you think I'm doing okay with this?
You're doing great.
good.
Yes.
Okay.
You're all doing a great job with your patients. And I just wanted to have a quick review of suctioning. What's the rationale for suctioning a person's airway?
Suctioning can provide comfort to a patient by clearing the air passages and easing the work of breathing.
Oh, and of course improves oxygenation.
Great. Now, you want to limit the amount of time that suction is applied because oxygen-rich air is also removed with the secretions. What can happen if you suction for too long?
Can't that result in hypoxia, which is an inadequate amount of oxygen?
Exactly. When suctioning a patient, use personal protective equipment and aseptic technique at all times to prevent disease transmission.
And what should we assess when suctioning through the nose?
Well, you want to assess the nasal passages for obstruction and gather a history from the patient to find out previous problems like deviated septum or polyps.
Okay.
Now, I can't stress this enough. Suction should be applied when you are withdrawing the catheter. Never apply suction when inserting the catheter. Am I clear?
Right. As crystal.
Isabel.
Yep. Clear.
Okay. All right, let's go. That's what I'm talking about. You got it on that one.
Thank you. Hey, I figured it out. Schedule treatment effectively and timely.
That's got 2 A's.
Ands don't count.
What's that about?
Nothing. We're trying to figure out what stat means.
Ah, the age-old question.
Do you know what it means?
I'm sworn to secrecy.
I thought so. Huh. Knew it. Hello? Can I help you? What I'll have to do is I'll have to get...
Miss Lewis, the patient I have is pretty serious, and I need your help.
Of course. What's the situation?
Well, she had a cerebral vascular accident several years ago, which left her with residual muscle weakness, particularly in the throat. Her present condition has contributed to further weakness and poor muscle tone. She has a weak, ineffective cough, and she's unable to expectorate her secretions.
Have the nurses been suctioning her pharynx to remove the secretions and keep her airway clear?
Yeah, I think she needs to be suctioned now.
Okay, not a problem. Let's check the order for suctioning and see if we need to pre-medicate the patient with pain medication. And then we'll double-check your equipment.
Okay.
Great, that's there.
Okay. I think I have everything. The rest
Yeah?
is in the room.
Yeah, I think you do. Lead
Down
on.
this way. Okay. Miss Marconi?
Oh, hi, Anna.
Hi.
How
How are you doing?
Okay, I guess.
Okay. I'm going to help you get those secretions out of your throat. Okay. It'll be a little unpleasant during the actual suctioning.
All right.
But once we're done, you're going to feel a lot better. Okay. This is my instructor, Miss Lewis, and she's working with me today.
Hello, Mrs. Marconi. We're going to help you breathe easier.
That's great.
Okay, let me just take a look at your ID band. And can you tell me your name?
Julia Marconi.
Okay, just give me a moment to set up, all right?
Okay, fine.
Okay. I think I'm good.
Okay, so let's get you into position. I'm a righty, so I'm going to be on this side.
Okay, then I'm going to go around to the other side, Anna.
Okay. Let me lower these rails. And let's get this across your chest. Okay. All right, can you turn on the suction unit?
Sure. Okay. Here you go. Okay. Now we're looking good over here. The suction is on at 100 to 120 millimeters mercury of pressure since she's an adult.
Okay, this is where I need some help.
Sure, Anna. Well, the suction's on, so open the saline and then open the sterile suction catheter package and put on the sterile gloves.
Okay.
Uh-huh.
Now I set up the sterile container by pouring the sterile saline into it.
Right. Your dominant hand will remain sterile during the procedure because it will handle the catheter. Your non-dominant hand can be considered clean rather than sterile, so you can use it to pour the saline. Now pick up the sterile catheter with your dominant hand. Use your non-dominant hand to connect it to the suction unit tubing. Don't touch the sterile catheter with your non-dominant hand.
Okay.
Right.
Now I dip the catheter into the sterile saline to moisten it.
Uh-huh. Occlude the Y port to check the suction. The saline solution should flow through the tubing.
Okay, looks good.
Now estimate the distance from the patient's earlobe to her nostril. And then place your thumb and forefinger of your sterile hand at the point on the catheter that equals the estimated distance. So that's the distance that the catheter will be inserted.
Got it. Now I'll insert the catheter without applying any suction. You're going to feel a little pressure. Just try to relax, okay? You're doing great.
You know this. Just keep the Y port open during insertion. The catheter should slip along the floor of the nostril toward the trachea to suction the nasopharynx.
Okay, I've reached a predetermined distance.
Very good. Apply suction by occluding the Y port with your thumb on your non-dominant hand. Gently rotate the catheter as you withdraw it from the airway. Don't suction for more than 10 to 15 seconds at a time.
Now I insert the catheter in the sterile saline solution to flush it.
Very good. Repeat the suctioning procedure as needed to clear the secretions, allowing at least 20 to 30-second intervals between suctioning attempts.
Okay, Mrs. Marconi, can you cough for me? All right. Take some deep breaths. Good. Okay. Very good, Mrs. Marconi. I'll just wrap the catheter inside my gloved hand and remove my gloves by containing the catheter inside the gloves.
Great. Now dispose of them and any other used supplies in an appropriate container. And let's get out of our PPE.
Okay.
Hi.
A little better?
Oh, feeling a lot more comfortable.
Good. I'm going to take a listen to your chest, okay? All right. Let's take some deep breaths. Very good, Mrs. Marconi. Let's get you back down here. Okay. Last thing as always, document the procedure.
Note the nature and amount of the secretions, your respiratory assessment before and after the procedure, and your patient's response to the procedure.
Okay. You doing all right now? Good. Thank you. This here for you. All right. See you in a little bit.
Bye-bye.
Something.
Hi, excuse me.
Sorry.
Paul Simon.
I recognize it. Good job today. Now, Mark encountered an interesting situation. Mark, why don't you tell them about it?
Oh, well, this was a little crazy. At the beginning of my day, I was assessing my patient's respiratory status, including her oxygen saturation. Now, she was receiving oxygen by nasal cannula at 2 liters per minute, and she felt fine. No shortness of breath, no other problems, and my assessment didn't reveal any acute distresses.
So, is there a problem in this?
Right.
Okay, here it is. The pulse oximeter read a low saturation level of 88% with irregular meter pulsations.
Oh.
Yeah.
Okay, Melissa, what should you do?
Well, I'd evaluate all current data to determine if the patient is in distress.
But she didn't appear to be short of breath or in distress.
No.
Okay, then check all the connections to the pulse oximeter and make sure the patient held the sensor still.
What else?
Maybe try a different site for the oximeter.
Good. But what did you do, Mark?
Well, I checked the oxygen system, the flow meter, the tubing, the connections for patency, and then I used the earlobe sensor.
And then what?
Okay, well, remember I said there were irregular meter pulsations, right? Well, the patient has peripheral vascular disease, which I didn't take into consideration. So the circulation in her hands is compromised. So once I used the earlobe sensor, the reading was 96% on her oxygen, which was right in line with my original assessment.
That's it. Very good. However, if no problems are noted and the oximeter is working correctly, you would check her vital signs, then reassess her respiratory status and notify her primary care provider of your findings. Well done. Now, I know we had a quick review about suctioning earlier, and and I wanted to talk to you about what to do if something goes wrong. Anna did really well today, but what if she was suctioning her patient and she noticed that the secretions that were coming out, which had been yellow or tan, were now blood tinged? What should you do in this situation?
Well, wouldn't you stop suctioning?
Yes.
And replace her oxygen supply.
I would probably assess her respiratory status, take her vitals, and look for any other symptoms or complaints.
You're all right. And of course, you should notify her primary care provider. Everyone good? Anything else?
Nope, I'm good.
Thank you, Mark. Now, is everyone else okay?
Yes.
Yes.
Very good. Well done today. That's it. Get out of here. Go have fun.
All right.
Which means my couch and a movie.
I need pajamas and ice cream. Stat.
Which doesn't mean anything.
Right.
Listen here, e pluribus unum. I'm not just taking your word on that.
Oh, really?
Oh, really?